Welcome back. Now, if you struggle with cervical disc disease, know someone who does, or you think this might be something that you're dealing with, this information is for you. Dr. Baldwin is tackling this subject today all the way from symptoms to treatment. Doctor, thank you so much for being here with us.
Thank you for having me here. Good morning.
Let's start a little bit with your background.
I'm a neurosurgeon. I did a 7-year residency in brain and spine neurosurgery at the Barrow Institute. I also did some fellowship training in complex skull-based surgery, and now my practice encompasses primarily brain tumors and then also complex spine.
Okay, and so I know I did mention we're going to be talking about cervical disc disease and what that is. Can you kind of put that in a term we can understand?
Sure. So as we age, and I brought a model.
Oh, perfect.
It's not a great model because it has the actual disc implant, but the cervical discs are the cushioning cartilaginous structures that are between the cervical vertebrae.
Okay.
And what happens is that as we age, they dry out and they can push on the spinal cord or the nerve roots, creating symptoms of neck pain, arm pain, or even in some cases, spinal cord symptoms like difficulty walking or using our hands.
Wow. And so how does someone maybe get this? I know you mentioned a little bit about age.
So it can also happen traumatically. You frequently see sports injuries. It can also be just from wear and tear. It can also be from working out too hard in the gym, working too vigorously in your backyard, and all of a sudden somebody gets some arm symptoms, ends up in the emergency room with extreme pain. They do an imaging study like an MRI scan and find that there's pressure on a nerve root.
Now, are there some symptoms that we should be looking out for?
Yes. As I mentioned, numbness and tingling into a hand that generally originates in the neck and tends to course down the hand or arm into the hand, or any type of weakness. And then on neurologic testing, when we see the patients in our clinic, we'll notice actual weakness on testing, loss of a reflex, numbness, and a specific nerve distribution.
So that's how it's diagnosed?
Yes.
And so once we have that diagnosis, what's the treatment?
So we always start with conservative treatment unless there's evidence of spinal cord compression. So typically the patients that come in with neck pain, arm pain, are given a trial of conservative management up to 6 weeks to 2 months. That usually entails traction, going to a physical therapist, rest, and in probably half to 2/3 of the cases resolve with conservative management. And then the ones that don't end up seeing me for surgical options.
Okay, and I know we were going to also talk about a procedure that's available.
Yes.
That not only yourself but somebody else in your practice also handles in this case.
Correct. So the typical procedure for cervical disc disease was generally accomplished through an anterior approach through the front of the neck, where we actually took the disc out and fused the bones together.
Okay.
And in the process of taking the disc out, we could visualize under the microscope the nerve roots. One of the more older procedures was actually going through the back of the neck and operating on just the nerve root as it coursed out between the overlapping bones, but we found that that's probably not as successful as going in through the front. But now we know from studies and our own clinical experience that having a cervical fusion is not necessarily benign. It is immediately successful in alleviating the arm and neck pain, but now 5 and 10 years down the road, we're seeing patients that have adjacent level disease. And so they end up coming back needing adjacent level fusion. So this is a revolutionary procedure that now allows for motion preservation. And so it's the standard approach for cervical disc done through the front of the neck with this new feat of engineering implant made by Zimmer. Previously LDR was a French company, and it has cobalt chrome end plates and a polyethylene core with this is all engineering terms of course, but with the sliding axis of flexion extension.
Right.
So when we compare a live patient on a video x-ray with the patient with the cervical disc, the motion is actually identical. And so we have motion preservation, and the FDA that was done to allow this disc to come to market, in 500 patients, class 2 evidence at 2 years, patients had a faster return to work and satisfaction rate with the motion preservation than the fusion patients. And then at 5 years, we know that they had a lower level of revisions. So the motion preservation decreases the rate at which people come back and need additional surgery.
Well, I know we were talking about Dr. Matt Wilson, of course, is the other.
Correct. Matt Wilson is my partner in Western Neuro.
And Western Neuro. And
Yes.
who is all involved? I know we're talking about Surge Center Tucson, but this is a bigger group that basically handles this.
Yes. So Surge Center of Tucson is our outpatient facility that Dr. Wilson and I both practice at. The cervical discs can be done as an outpatient and the appropriately selected patient who's healthy and can tolerate either a 1 or 2 level surgery in the same day and actually be discharged the same day. And then also Carondelet St. Joseph's, where we are on staff and have a very close alliance with, the procedures can be done there also, either inpatient or outpatient.
Perfect. This was a great explanation, Doctor, today. I'm going to remind everyone how they can get a hold of you. And of course, if this is the correct path for them, you're definitely in good hands with you and with Dr. Matt Wilson. Thank you so much again for coming in.
Thank you for having me.
Now, you can learn more about Western Neurosurgery by calling 881-8400, and their address is 6567 East Carondelet Drive, Suite 305. You can also log on to westernneuro.com.